Thank you so much for being available today to talk with me on the podcast. I really value your time and you're just a wealth of knowledge, so I appreciate it very much. If you would do a quick intro of who you are and what has led you to where you are today.
Sure. I'm Jennifer Kent. I'm a fourth generation Californian. I have had the great pleasure of working primarily in state government for most of my career. I had a brief stint in the legislature. I've been a trade association lobbyist. I went to the Department of Health Services in 2004 under Governor Schwarzenegger, stayed at Health Services for a couple of years, went to Health and Human Services Agency, went to the governor's office, all under Schwarzenegger, went back out into the private sector for a little bit, came back under Jerry Brown as the director of healthcare services, stayed under the last 4 years under Brown, and about a year into the Newsom administration. So all things HHS, and now doing some consulting on the side, but really have always loved being a part of state government. I find it the most consequential in people's lives, and you
Yeah.
have a lot of impact, and so have been really pleased to spend a lot of time helping California both adopt the ACA, but also seeing it through both Great Recession, which was really
Mm,
difficult, as well as being a part of some of the consequential expansions that we've done in California for individuals that have otherwise not had access to health coverage.
You are a new type of guest for me. I've had a lot of legislative experts, and I love delving into the administration element because it is clearly the other piece of
The
this very
black
big
box.
puzzle, the other
Mhm.
black box for sure, that advocates struggle to figure out how to move. You reminded me of a reality that 11, 12 years ago, the state budget was in a way different situation. It's interesting for those of us who were there in the trenches battling $60 billion deficits in
Mhm.
the last, I would say, year or two of Schwarzenegger and for
Yeah,
most of
I
the
was there.
Brown era,
Mhm. Yeah.
where the battle was just preserving services, never mind expanding anything.
Correct.
Post COVID, I would say this whole like we're just swimming in revenue for some folks, especially for the newer legislators, like that's what they now know. For those of us and the ones who've been there for a while, knowing how quickly things can turn and how much awful it is to govern during that time period. Let's then get present with today.
Okay.
And this is super timely because it's now, I believe, July 11th today. It is post fiscal year 22-23 budget has been signed by the governor and appropriated by the legislature. It's sort of a rest period, but not really, because as we'll talk, this process for next year's budget is already going.
Yeah.
If you really want to talk about getting something funded, now is the time when you should start that process, not after the January budget. Even though that's when most people really start getting active on budget, the sweet spot is as the administration is crafting the January budget. And that is not easy, but especially once you've made your case and say it's been something you've been talking about for a long time, they could be adopted as a governor priority. I'd love to pick your brain on what is happening right now. And we don't need to get into the nitty gritty, but at least from my outsider's perspective, when we say the process has started, what does that look like?
So the first thing is there's not ever a downtime when you're
Yeah.
working on the executive branch. What happens is starting in June-ish is departments across the administration will get essentially call letters from the Department of Finance saying you need to start developing your budget concepts. Concepts are a way in which departments start the process of asking for either funding and or staffing for anticipated workload in the next fiscal year. So you are starting a good 6 months in developing those concepts for the governor's January budget.
Mm.
So as the departments are finishing the fiscal year, like you just mentioned, they have already started building the next fiscal year's budget. So what happens is any department, not only just HHS, but any department within the administration, they are looking out and saying, we believe that we're going to need 5 more staff in this program. because we have a backlog or we have a waiting list or we have a timing perspective that we cannot keep up with the work, or we have a new federal mandate, or we have a bill that was signed by the governor that will create workload. So they are developing those concepts for departments that have estimates. You are developing what you believe will be the caseload or the growth or the changes in that particular program. And you're doing that now. And it takes that long from now until January to do all of that internal thinking and work. So if you are an advocate or an organization that wants to impact that process, the first and most important thing you should understand is that it's a one-way communication,
Mm,
meaning you can put information into that department to help inform their thinking, to help highlight perhaps a need for more resources in a certain program area, but those departments are not going to respond to you.
that is very important to note because sometimes we receive silence in a bad way, but they're not going to. They just can't actually.
Right, silence is them doing their job.
Mhm,
That is what the administration's role is. They're happy to take information and they will acknowledge it and
mhm.
say, "Thanks for sharing," or "We
Yeah,
appreciate you giving us that feedback."
yeah.
But it is very, very, very unusual for a department to be like, "Oh, you've asked for money in the budget next year. We'd really like to sit down and talk to you about it." Again,
Mhm,
because the analysis and the deliberations within the administration about what goes into that January budget are all confidential and protected. And so you should not be offended if you don't get any response or feedback or a meeting request. But you should, I will stress this, you should at least try
mhm,
because you could impact someone's thinking or analysis in any
mm,
department right now.
mhm,
They're like,
mhm,
oh, that's a good point. This organization has highlighted the need that we will need more resources or we will need funding or we will need
mm,
staff
mhm,
to do this in the coming year, and maybe we should accommodate that. And then as the year progresses, those budget meetings become more and more both deliberate in terms of
mhm,
those concepts turn into proposals.
mhm,
Those proposals are vetted through agencies and with the Department of Finance. The Department of Finance is also churning away on what they think the revenues are going to look like. And based on what the revenues are going to look like, then that informs what actually goes into the budget. And the kind of holidays are really miserable, right? A really terrible time to work at the Department of Finance in the
I have
administration.
always thought the people at finance, man, whoo,
Deserve all the kudos. But what that really showcases is that the work that you have done all summer and fall comes to this really important point starting around November. That's when your final decisions are being made about the
mm,
budget for January.
mm,
I can't tell you how many people asked to meet with me when I was at the department, usually around December, like, "Oh, we'd
mm,
like to talk to you about something that we would like you to put in the governor's budget." And you really wanna laugh because that budget was signed, sealed, and delivered 2 months ago, right? It is
mm.
locked.
Yep.
So it's really important for people to understand that things are closed down from a decision standpoint by and large at November at the latest. The things that are kind of put in for the governor's January budget are usually based on what is available from a revenue standpoint, but it is a rare thing to be able to get something in that late.
That's so important. Thank you for actually flagging that. Taking a step back, if we're talking about new stuff, like a new pilot program or a new initiative or something that is not a question of it's already happened and it's a question of budgeting for it. It's more of an ideas conversation, right? Like,
Mhm.
wouldn't it be fantastic, Governor, if California took the lead on this, right? We're seeing this trend all across the country. We think California should take a stand. The ecosystem to map this out for folks who aren't living and breathing this world is you have departments, which are basically implementation
The
administration
engines.
engines that
Mhm.
make all of this manifest, right? You have the agency, which is sort of the umbrella,
External frame of the car.
the frame of the car. You've got the secretary of the agency who is appointed directly by the governor and responds directly to the governor.
And governor's
Then
driving the car.
he or she is driving. But then you've got the governor's office, which are his sort of policy consultants and
Correct.
his, I would say, bigger picture thinker people. And all of these people are important and part of this conversation. You've got also finance. People
The
do not
gas.
understand how important it is to talk to
They're the
finance.
gas.
Even if the gas, I love that. So even if they're literally looking at you blankly, which to me is part of the process of meeting with finance, you still need to do it
Absolutely.
because the last thing you want is for someone to say, I've never heard this idea before, and to basically put the kibosh at the, you've done all this groundwork. And I say this even within the legislative budget process. You do all of this legwork. You don't want some important person to say, well, I never heard this before.
Right.
Is that in and of itself could tank you, basically.
Right. The role of a really good, successful lobbyist when you are lobbying the executive branch means that you understand every single part of what you just talked about, right? You understand the role of the department, you understand the role of agency, you understand the role of finance, and you understand the role of the governor's office. And there are a lot of individuals, well-intentioned, that don't understand that this is a very complicated family structure in terms of whose roles are used at what particular time and how.
Mm-hmm.
So if you are, and it's both for legislation pending before the governor as well as budget items,
Mm-hmm.
is you should always touch base with the department. They may or may not be able to give you feedback.
Mm-hmm.
You should always touch base with agency because in particular HHS agency, you may think that your bill only impacts the Department of Healthcare Services, but there may be
Mm.
impacts at social services, DDS,
Mm.
Department of
Mhm.
Rehab. And so agency's job is to sort out
Mhm.
differing opinions by different departments
Mm.
and come up with a consolidated recommendation. And then I can't stress enough the importance of what finance does and impacts
Mhm.
on a department's recommendation overall. And so
Yeah.
you have to literally touch every single touchstone
Yeah.
if you want to make sure that you are
Yeah.
at least doing your job.
Yeah, and trying to actually make it happen. To me, that's what makes budget advocacy so exhausting. But you keep going. Persistence is key and not forgetting about the different people in the ecosystem,
Correct.
basically.
When I worked in the governor's office directly, there were several times in which someone would come to meet with me about a bill. And obviously I knew that the department had a official position on that piece of legislation. And I would ask the lobbyist that was meeting with me if
Mm.
they had addressed those department concerns. And then they would argue with me about why the department's amendments and position was wrong,
Mm.
not knowing that I was the one that actually approved the department to go out and try to
Yeah.
work the bill. And so I
Yeah.
think people also don't understand that
Mm.
departments don't
Mhm.
release positions or amendments or share concerns
Mm.
unless and until they have been allowed to.
Mhm.
And so anyone lobbying either a budget item or a legislative bill that
Mm.
hears from a department that there are issues
Mhm.
needs to understand that that comes and is authorized by the governor's office.
Yeah, no one's acting independently here.
Correct.
Yeah.
And you should never interpret technical assistance as approval. And that also gets mistaken more often than not in that a department can be working with you on technical assistance for a bill or a
Yes.
budget item. That
Yes.
does not mean that they are okay with it
Oh, that's so important. I'm so glad you just said that. Yes.
because people oftentimes we would work on a piece of legislation and provide technical assistance and the governor would ultimately veto the bill.
Mm.
And I would
Yeah.
get a boomeranged, very unhappy lobbyist or
Yeah.
organization, and I would have to explain it was our job to work with the author and sponsor that if the governor decided to sign the bill,
Mhm.
it could be implemented. It wasn't
Mhm.
that we were okay with the policy, it was that we were making sure it was constructed in the right way.
Mm.
And so
Mhm.
you should never interpret technical assistance as a sign of support.
Again, thank you for raising that, and I would even go further in that I had an early experience with a bill where it was technical assistance working with the department on the bill, but it was internal conversation where there was a sort of off the record wink, wink, we think this is good. And I interpreted that as, well, then the governor's office must think it's good too. So imagine me on veto day feeling like I just got stabbed in the heart, which by the way, I'm like breaking all the rules and not loving your bills, but I always just felt very strong about my work at UDW. But I learned the worst lesson in the worst way. That's true for the legislature as well. Staff recommendations, you cannot do a vote count based on that.
Right.
Because at the end of the day, you're not the elected. It's them, and they may have all sorts of other considerations. This is the challenge for a good advocate is that you're talking with staff and that staff support it. And your balance is, okay, I get that, but I don't know if that's what the member thinks. And I'm trying to pin that part down, right? Sometimes that is actually almost impossible. And that is really, I would say, one of the hardest parts is when you're trying to fill that in, right? But you're right, it applies all across the board. So going back now, let's take a step back. In terms of process, the budget was just signed for next fiscal year. For those appropriations that were made,
Mhm.
that stakeholders effectively achieve this win, right? Awesome, wonderful. But that's like the beginning of it.
Yep.
Same with the bill. Getting signed is half the battle. And the other half or the other part of the budget appropriation is that that money is actually going to go the way you want it to go, right? It's going to be administered by, again, the departments in the way that the intent of it, the spirit of the appropriation was done. You don't just say yay and go away and that's the end of that, right? We got this money or we got this bill, but your influence is just as necessary in terms of the administration of it as it was before. And sometimes that's hard because you're tired, right? Like budget's done. The last thing you're thinking about is I want to go back and start having hard conversations again.
Yeah.
But that's what we signed up for.
When you're lobbying and you're successful in getting a budget appropriation for any client, organization, program, the first order is to look and see if there were any specifics in terms of the budget bill language, right? So the budget bill will have item number reference, and then we'll
Hmm.
say an amount of whatever, $5 million appropriated to the
Hmm.
Department of such and such for the creation of a whatever.
Hmm. Hmm.
If there's any subsequent language in that appropriation item, sometimes there will be, and that's helpful. And
Hmm.
if you are the one that is lobbying for that appropriation, you would
Hmm.
hopefully want to be a part of crafting that
Yeah.
because this is where you can make the funds more readily available
Hmm.
quicker. You
Hmm.
can get exemptions, right, from certain contracting requirements. You can try to make the money subject to a stakeholder process if that's
Hmm.
what you want.
Right. To
You
make sure that
can
you're involved, right?
you can try to have it go towards a very narrow either use. So think about that. And I think there were a couple of times when I was at the Department of Healthcare Services where we got a $2 million appropriation. It came in from the legislature. We had no background on
Mm,
what they intended, how they intended us to use it. And there
mm.
was one particular item where, after talking with the sponsor and the member who wanted it, we couldn't actually do what they wanted us to do with it.
Oh,
And the member actually ended up asking us to just not spend the money
interesting.
because they
Wow.
hadn't done enough thinking about how the funds could be used.
Got it.
So the first order is, as much as possible when you are lobbying for an appropriation, give some thought to how you want the money to be
Right.
spent.
Yep.
It's important to get the money first, but
Yep.
you also have to have a plan for how you
Yep.
want that money appropriated.
Yep. Yep.
And then once it's appropriated, the second lesson is you need to be patient
Mhm.
because these same departments that we just talked about that are developing next year's budget are
Mhm.
also finishing out a legislative bill cycle
Mhm.
as well as running their base programs.
Mhm.
And
Mhm.
there's all this new money that just got appropriated, and everyone comes clamoring to say, "When do I get my check?"
Mm.
And so sometimes those departments are having to sit down and figure out, okay, we just got $50 million to do this thing. We
Mhm.
have very little framework from the legislature. So we're going to have to create it from whole cloth. And then they're
Mhm.
doing the same kind of analysis.
Mhm.
Do we have any contract exemptions? Do we have to run a procurement? Do we
Mhm.
have any identified external stakeholders that we can contract with
Mhm.
to
Mhm.
use this money? I mean, so there's all of
Right.
that.
Right.
So I would encourage anyone that is successful in a budget appropriation to come to a department with some of those key suggestions and or recommendations for how the money could go out the door.
That's great. And it reminds me, taking a step back again, around this notion of trailer bill versus budget bill language,
Correct.
right?
Important.
BBL versus TBL, very different, totally
BBL and
different.
TBL are very different. Correct.
Right. So this is my understanding. Okay. BBL, that language is only as active so long as that bill is active, right? A budget bill is a 1-year appropriation. So it doesn't exist. It's not codified in law after that year, right?
Correct.
That language goes away.
Correct.
That provides a lot of flexibility that the administration very much wants. Trailer bill, on the other hand, is modifying code. It's actually changing the law.
Correct.
And from an advocate's perspective, you always want trailer bill language if you are trying to be prescriptive about what you want this money to do,
Yeah.
or you're trying to change policy, because that's the other unspoken part of the budget advocacy is you could do a lot of non-budget things in trailer bill. Learned that during the Brown administration. And those are very different. And the reality is we want TBL, but if we have BBL, budget bill language, okay, let's again try to be as prescriptive as we can. And sometimes there's nothing we can do to control that either, right?
Yeah. It
Yeah.
it just depends. A few years back with the Prop 56 revenues was all done through BBL.
Mm,
That was beneficial to both the administration as well as the proponents of Prop 56 because we weren't quite sure how we were going to implement it. And in the crucible of budget negotiations, sometimes you simply just don't have the time
mm,
to come up with
mhm,
financing methodologies
mhm,
and specifics. And
mhm,
so you are correct. You are embarking on a trust relationship when it is done through BBL because there is not a whole lot of statutory heft as opposed to TBL sometimes can be too restrictive. And there have been times in which advocates wanted TBL, successfully got TBL,
mhm.
and then as you moved through the process, realized that it was preventing the department from doing the very thing that you wanted them to do. And then
Mm,
you have to go back to the legislature and change the
interesting.
statute. And so it cuts both ways.
Interesting. Okay, I think that's a really good perspective. Okay, it could go both ways.
Yes.
Okay, so I take that back. It's not necessarily the case that you push for TBL.
I've seen it done both ways, and I've seen it hurt both ways.
I am loving this conversation and I want to be respectful of your time. So before we close, I would love to ask you, what is your parting piece of advice, words of wisdom, or if I knew then what I know now, I would change this for
Um,
advocates?
I would think from an advocacy standpoint, and again, I'm speaking from the point of view from the days in which general fund was remarkably scarce.
Mm,
It was really, really difficult because people always came and brought problems to the governor's office, to agencies, to departments, and said, "Here's my problem. I need
mhm,
money. I
mhm,
need a rate increase. I need a new benefit. I need a something, something." Right? They were
mhm,
advocating for something.
mhm.
They did not bring solutions.
Mm.
And especially when there were budget cuts, they came and said, "Don't cut me,"
Mm,
but they didn't offer an alternative. Or in some cases, when cuts were unavoidable, what would have really been helpful is for people to say, "Okay, understand that you have to do a cut. Can you do it in this way instead of this way?" Right? Can you tailor it? Can you phase it? Can you target it to this particular part of the program as opposed to
mm,
this particular part of the program? And so
mhm, mhm,
the best advocates that I have worked with in my career have been ones that not only rightfully acknowledge problems, weaknesses, shortfalls in the program, but
mhm.
they also bring alternatives and solutions. And because finance's main job is always to protect the general fund,
Right.
think first about using different financing solutions that don't just tap the general fund. That is the hardest thing to do, is
Mhm,
to successfully get general fund, even
mhm,
in a
mhm.
budget year as the one that we just saw, as there were a lot of people that were not successful, right?
That is very true. A lot
And
of not happy people right now. Right.
Right, and so I would always recommend to people, be really thoughtful when you encounter anyone in the administration to A, appreciate how hard they're working,
Yeah.
B, understand all of the competing priorities that they're juggling,
Yeah.
and then be respectful of their time and offer solutions as
Mm.
opposed to just come to them with a problem.
Oh, I like that. This is great, Jen. I really appreciate it. It would take you years to figure this stuff out. And even if you're saying it, it's still going to take time to figure it out because sometimes you can hear it and it doesn't make any sense. And sometimes we learn things the hard way, and it would be nice to have a little bit more direction. And so this is just fabulous. I can't thank you enough.
Well, I've loved talking to you.